lot of issues today when it comes to women navigating the healthcare system, and I kind of put them in two big broad categories. The first is sort of design and access. We sort of have this one-size-fits-all system where we try to make everybody fit into sort of one way of doing things. And we know that women are different, our bodies are different, our lifestyles are different, our responsibilities are different. And so sometimes navigating the responsibilities of being a woman and accessing the healthcare system are in direct conflict with each other.
I think the pandemic has also exposed some gender inequalities that have long been present in our society. So for example, women in Canada actually provide the majority of the caregiving, unpaid caregiving work. And this has really been exacerbated during the pandemic because schools have been closed. Programs for seniors and adults with disabilities have all been closed because of COVID. And this has created an increasing strain on our women.
I see some significant issues facing women in accessing mental health care. And accessing healthcare isn't just about getting in to see somebody. It's also about the kind of treatment that you get, the follow-up care that you receive, or the stigma that you might experience from other healthcare professionals.
There continues to be gender bias in the way we identify medical conditions and we treat them. And so that is something that we continue to need to tackle both on the front lines as individuals, but also as researchers and healthcare systems.
Not all women are having the same experience. So women who are more marginalized, those who are living in poverty, those who are racialized, who are Indigenous, who have different abilities, who can't speak English, they're having a different care experience. Unfortunately, as a result of things like racism or not being able to access care in the language that they're most comfortable with, as an example.
The entire body of health research that we base all of our clinical practice on is largely data that we gathered from men. And I think until more women are integrated into the research process, doing research, participating in research, and having research done about us, I think that we're still going to have therapies that are targeted for people other than our bodies.
I think there's still a lot that needs to be done. We know that there's gender bias in how we still diagnose and treat women for various medical conditions. However, we're very fortunate at St. Michael's Hospital to be part of a large research community as well. And as a result, we have the opportunity to work with some of our researchers to really close that gap.
So another way I think we can improve the care experience for women in healthcare is by looking after our healthcare workforce, because 80% of our healthcare workers are women. And women need psychological support right now, dealing with the trauma of the COVID pandemic. They need access to full-time work opportunities, sick time, benefits, and opportunities for professional development and career advancement. And we need actually more women in leadership roles, because even though we make up 80% of the healthcare workforce, we are underrepresented at leadership tables. And this is especially true for Indigenous women, Black women, and women of color. And diversity of women at the leadership tables will help influence the policies and processes and procedures in place in our healthcare system.
So there's many factors I think that we need to think about when we're thinking about women who come from different backgrounds with different needs. And I think we should really be prioritizing those different needs as we think through the care journey.
What I'm really excited about is the opportunity to involve women across all aspects of redesigning healthcare. I think the representation is extremely important. Women need to be involved in leadership. They need to be involved in research. They need to be involved on the clinical front line. And female patients need to be included in our design and delivery of a future healthcare system. And the fact that we're willing to do that here is so exciting.
The good news is that I see a lot of opportunity for change. And I think as clinicians, our role is to help patients to feel like their experience is being validated first and foremost. And secondly, to help them to become advocates for their own healthcare. And that can be also around learning about their symptoms or their diagnosis so that they can ask the questions they deserve the answers to make informed decisions about their treatment plan.
What does human care mean to me? It means care that is respectful, kind, and compassionate. That meets people where they're at, and that's not just person-centered, but community-centered. That it takes into account the background, the experiences that shape the health that someone has.
that patients' needs are met, not just in terms of their physical or medical needs, but their spiritual, emotional, and human needs, really. It means that we are developing connections with our patients and providing emotionally focused care.
What does human care mean to me? It means collaborating with patients with regard to their treatment planning. It means educating them about complex topics about their healthcare. And it also means encouraging them to be advocates for their own healthcare.
It means that the people on the front lines taking care of them love their job and love being part of delivering healthcare to the people that they are meeting each day.
It means a place where women can come and access healthcare and feel like the system they're accessing was designed for them.
We've gotten rid of disparities in outcomes. No longer does your background affect how long you live. Now the care you get can help to close that gap.